And a supplement could be uniquely poised to support circulation in ways that, let's say, diet can't.
We are talking about Arginetix, obviously. Mm-hmm. And Arginetix was designed for that purpose alone. It is to improve the immune system, at the same time to improve microvascular circulation. Consistently, we have found that people who take Arginetix have lower blood pressure because we vasodilate. What do blood pressure medication in general do? Makes the arteries bigger. But we are doing it at a microvascular level, where we're increasing the amount of nitric oxide, and the nitric oxide in turn vasodilates the small capillaries. When the vascular resistance drops, blood pressure drops. If you improve blood flow by improving the size of the artery, then even if microparticles of clots form, it gets flushed out. So they don't aggregate. And that's the whole idea of why nutrition is so important in preventing clot formation, preventing stroke, preventing heart attack, preventing renal problems, preventing circulation problems in the legs. Everything is based on how much blood flow to a tissue and how much of oxygen we get to this tissue.
And I would say possibly reducing inflammation?
Absolutely. Because if the products contains natural occurring anti-inflammatory substances, mm-hmm. obviously it is going to decrease inflammation. We have actually done the study on it. Mm-hmm. What we did was we took patients, healthy individuals, and what we said is, okay, let's look at the diameter of the artery with different types of food, okay, including cigarette smoking, by the way. So what we did was we took the brachial artery, okay, brachial artery is the artery that supplies the arm right here. So we took them without any food, fasting for 12 hours, okay, and they had lots of hydration, so that is normal blood flow is established. Then you tell the patient, go have a food high in vegetables, high in fruits. About 2 hours later, let's image the artery. When you image the artery, you'll notice when you're having good, healthy food, the artery's diameter actually increases, by the way. Okay?
Yeah.
Same thing you will do with Arginetix.
Right.
Now you go back and eat your French fries. I don't want to name any names. Mm-hmm. Deep fried food, or cigarette smoking, okay, or stress. Okay, when you're under a lot of stress, you yelled at somebody, you come back, you look at the same artery. 2 hours later, after French fries, you'll notice the artery would have compressed, would have constricted rather than vasodilated. That tells you how much food and supplements have a direct impact on the artery immediately. Now, if an artery is vasodilated, the flow is gentle, laminar flow, doesn't cause stress on the arterial wall. Okay? The same token, if the artery is vasoconstricted, it's like taking a pipe that you're spraying in the yard. What do? You push the end of the pipe so you can spray faster, right? Velocity increases. With velocity, shear force increases. It damages the arterial wall. So you rather have slow, gentle, laminar flow as opposed to fast, constricted, tubular flow that causes damage to your arterial wall.
And a follow-up question to that, and it's somewhat unrelated, but I've used Arginetix, and I had both cramps in my calf, and I had a partial tear in the calf. Mm-hmm. And I came back and I was playing, and I was recovering. I could still feel, but I was recovering. And I remember talking to Dan about it, and it was about increasing blood flow back into the area where I was injured faster. And it reminds me of the stories of relief pitchers who basically have to come back every single day and come through the wear and tear of their body athletically. How is that working mechanically?
So very simple. Do not take Arginetix for about 2 weeks.
Mm-hmm.
Cut your nails. See how fast your nail grows. Or have a haircut. Don't take Arginetix for 2 weeks and cut your hair and see how fast your hair grows. Now go back and start taking Arginetix for 2 weeks. Cut your nails and see how fast your nail grows. Simple things you can do. Or cut your hair and take Arginetix obviously 2 weeks before you cut your hair. Cut your hair, then see how fast you have to go back to the barber to have another cut. So that, what it tells you, what did I just explain? Explain how improving blood flow to end organ causes more growth. Okay? Similarly, when you have injury or when you're exercising, you have cramps. Why do you have cramps? You have cramps because lactic acid builds up. Okay? The muscle has used up all its oxygen because you've exercised really vigorously, and therefore lactic acid builds up, and that is what causes cramping and muscle pain. If I were to improve blood flow to the muscle of your calves, it washes off the lactic acid very rapidly, so lactic acid doesn't accumulate. We go from so-called non-oxidative phosphorylation, because there is an oxygen debt, to a pyruvate cycle, to oxygenation, therefore causing oxidative phosphorylation, converting the lactic acid into more energy. More oxygen is needed to break pyruvate to metabolize, washing out all the lactic acid, and your muscle recover much faster. So if you have injury, you have a wound that is cut, you want to deliver more nutrients to the site. If you develop more nutrients to the site, faster it heals. That's the principle.
So it makes perfect sense in a different kind of situation that it would be great for stroke prevention.
Absolutely, because it improves blood circulation to the brain, just like it improves blood circulation everywhere. So it is more important for prevention, and that's what we're trying to do. Prevent a heart attack, prevent a stroke, prevent any injuries. Lack of blood flow to the leg will cause ulcers to form, and that's what we want to do. Anything that improves blood circulation. As a cardiologist, that's my specialty, right? Mm-hmm. Improving circulation. We do it through stenting, we do it through exercise, we do it to whatever manner possible to improve blood flow in every tissue in our body. That is my job.
And it would make sense then, say it could be, this might be a little stretch, but I would say dementia prevention, right? Or to keep your wits about you longer period.
In a certain way, yes. When you call about dementia could be Alzheimer's. Mm-hmm. Alzheimer's is a different animal altogether. That is to do with our deterioration of brain function, secondary to some plaque buildup, and therefore that may not have anything to do with microvascular circulation. However, dementia can also be multi-infarct dementia. People who get dementia because they're having small strokes. Right. And that is more prevalent than Alzheimer's, by the way. Mm-hmm. Okay. Therefore, the older you get, less circulation you have to your brain, because that's part and parcel of the aging process. Mm-hmm. And that leads to more microvascular problems resulting in minor strokes that goes undetected, ends up in dementia. If that is the etiology, anything that improves circulation would help prevent that, or at least attenuate.